The NIH is funding a 5-year, $5.7 million study on the effects of hormones on kids with gender confusion. Powerful and dangerous medications to disrupt normal puberty and to stop development are being given to kids as young as age 8. Cross-sex hormones, which are really wrong-sex hormones with high cardiovascular risk, have already been given to kids starting at age 12. Mastectomies of healthy breasts are being performed on girls as young as age 13 and 14, and we have uncovered even more. These experiments are being done under principal investigator Johanna Olson Kennedy of Children's Hospital, Los Angeles. The studies are being conducted there as well as at UC San Francisco, Chicago Lurie's Children's Hospital, and Boston's Children's Hospital. Why is the NIH allowing harmful drugs and surgeries to be performed on kids who are not old enough to consent? These procedures lead to infertility, cause sexual dysfunction, and with surgery cause permanent sterilization. There are also risks to cardiovascular health, brain and bone development, and mental health. We have ethical guidelines and laws to prevent harms to children and medical experiments, don't we? Have these been violated? Federal law under 46116 and 46117 govern informed consent in human research. Have these laws been violated? The basic question is this: how can a child or adolescent at age 9, 11, 14, or even 17 possibly consent to a lifetime of sterility and sexual dysfunction and irreversible surgeries? Even if one argues that it was the parents consenting, how can a parent provide consent for a child, even their own, to be permanently sterilized or without organs such as breasts? From the legal code, number 1, consent must be obtained without coercion. But coercion is being used because parents are being told that if they don't put their children into this type of therapy, their child will be in danger of committing suicide. 2, there must be, quote, a description of any reasonably foreseeable risks or discomforts to the subject. Were sterility risks fully presented? How about this extent of sexual dysfunction? Were the full risks of high-dose cross-sex hormones on the cardiovascular system and general health described? Number 3, quote, for research involving more than minimal risk, an explanation as to whether any medical treatments are available if injury occurs, and, if so, what they consist of or where further information may be obtained, end quote. Has there been information given if these patients wish to detransition about the medical and surgical therapy that would entail from this, or due to side effects of hormones? Number 4, quote, a disclosure of appropriate alternative procedures or courses of treatment, if any, that might be advantageous to the subject, end quote. Were the children or parents told about psychotherapy or other psychological treatments for this condition, or watching and waiting? Evidence from an article in The Atlantic quoting principal investigator Johanna Olson Kennedy suggests they are not. It says Olson opposes mandating mental health assessments for all kids seeking to transition. As she put it, I don't send someone to a therapist when I'm going to start them on insulin. And there has been more uncovered about this egregious research using the Freedom of Information Act. We know already that puberty blockers are being given to kids as young as age 8, and published reports from them show 12-year-old girls getting testosterone. But is that the youngest age? Tune into the Heritage Panel presentation at noon Eastern Time on March 28th for the answer.